What's the difference between saline and silicone implants? Well, from the outside, the shell of the implant, the actual coating, is pretty much the same. They're both made out of silicone. The big difference is what's on the inside. So on the inside of saline implants, it's saline. It's the same stuff that we use in IV fluids. It actually, when we put it in the OR, it comes out of an IV fluid bag. Now, for a silicone implant, the inside is made of silicone. It's a gel. That gel basically changes in different lines from different companies in how squishy it is. Some of them are really firm, some of them are a lot less firm. Now, which one do I prefer? Generally, I recommend silicone implants because saline implants have a couple of things that I don't like. They're a little bit heavier. They also have a much higher tendency to ripple. Now, if somebody has a lot of padding and they're going to put a small implant in, it really doesn't make that much of a difference. If somebody has a lot less padding and they're trying to put in a slightly larger implant, the rippling and those edges might be a lot more visible with the saline implant. Now, there is one rule though that we have to follow, is that saline implants are allowed to be used from 18 years old and older. Silicone implants, you have to be 22 years old and older to get this silicone implant. So sometimes, if it's somebody who's a little bit younger, we may have to use a saline implant.